Hello everyone, now let us discuss about 2023 ICD 10CM coding guidelines for chapter 21 part 6. As we have discussed earlier, chapter 21 mainly deals with factors influencing the health status and contact with health services, which mainly are governed by the Z codes. And in the current session, we will be discussing some of the Z codes that are related to status. In the current session, we will be discussing the following Z codes. The first one is Z67, that is nothing but blood type. The next is Z68, which is nothing but body mass index or BMI. The BMI code should only be assigned when there is an associated reportable diagnosis, such as obesity. And one important point is do not assign BMI codes during pregnancy. The next is Z74.01. It deals with bed confinement status. The next is Z76.82. Awaiting organ transplant status. The next is Z78. It deals with other specified health status. Z78.1 deals with physical restraint status, which may be used when it is documented by the provider that a patient has put in restraints during the current encounter. And please note that this code should not be reported when it is documented by the provider that a patient is temporarily restrained during a procedure. In that case, you should not code physical restraint status. And finally, Z79, which deals with long-term current drug therapy. Long-term use but current drug therapy. The codes from this category indicate a patient's continuous use of a prescribed drug, including such things as aspirin therapy, for a long-term treatment of a condition or for prophylactic use. It is not for use for patients who have addiction to drugs. And next is, this subcategory is not for use for medication for detoxification or maintenance program to prevent withdrawal symptoms. For example, methadone maintenance to opiate dependence, and assign the appropriate codes for drug use, abuse and dependence instead of this long-term drug use. That is, this is not used when the medications are used for detoxification or for maintenance program. An example here is methadone maintenance for opiate dependence. Here you should not code long-term use of methadone. Instead of that, you need to code opiate dependence code. And assign a code from Z79 if the patient is receiving a medication for an extended period as a prophylactic measure, such as prevention of deep vein thrombosis or a treatment of chronic conditions such as arthritis or a disease requiring lengthy course of treatment, for example, cancer. And do not assign a code from category Z79 for medication being administered for a brief period of time or to treat an acute illness or injury, such as course of antibiotics to treat acute bronchitis. Now coming to blood type or Z67 series. The first code is Z67.10. It deals with type A blood Rh positive. When the blood group is A positive, you need to code Z67.10. The next is Z67.11, type A blood Rh negative. The next is Z67.20, type B blood Rh positive, that is B positive. The next is Z67.21, type B blood Rh negative, that is B negative. Next is Z67.30, type AB blood Rh positive, and Z67.31 deals with type AB blood Rh negative. The next is Z67.40, type O blood Rh positive, and Z67.41, type O blood Rh negative. And finally, Z67.90, unspecified blood type Rh positive, and Z67.91 deals with unspecified blood type Rh negative. Now coming to body mass index or BMI codes. The first code is Z68.1. When the body mass index is 19.9 or less in an adult. There are different codes for adult and child. The next is Z68.20. Body mass index. BMI is in the range 20.0 to 20.9 adult. Next code is Z68.21. It is used when the BMI is between 21 to 21.0 to 21.9. The next is Z68.22. It deals with when the BMI is 22.0 to 22.9. The next is Z68.23. When the BMI is in the range 23.0 to 23.9. The next is Z68.24. When the BMI is in the range 24.0 to 24.9. The next is Z68.25 when the BMI is in the range 25.0 to 25.9. The next is Z68.26 when the BMI is in the range 26.0 to 26.9. The next is Z68.27 when the BMI is in the range 27.0 to 27.9. The next is Z68.28 when the BMI is in the range 28.0 to 28.9. The next is Z68.29 when the BMI is in the range 29.0 to 29.9. Simply from 20 to 29, you can take the decimal of BMI. If you see, Z68.20 is used when the BMI is in the range 20.0 to 20.9. And 21 is used when it is in the range 21.0 to 21.9. But this is a little tricky. In the next slide, you can see here also the same logic is applicable. Z68.30 indicates when the BMI is in the range 30.0 to 30.9. 31 indicates 31.0 to 31.9. 32 indicates 32.0 to 32.9. And so on. 39. Z68.39 indicates BMI in the range 39.0 to 39.9. All are adult codes. But the BMI varies once it is above 40. Here you can see Z68.41 indicates body mass index in the range 40.0 to 44.9. It is not 40.9, it is still 44.9. The next is Z68.42. It is coded when the BMI is in the range 45.0 to 49.9. The next is Z68.43 is coded when the BMI is in the range 50.0 to 59.9. The next is Z68.44 is coded when the BMI is in the range 60.0 to 60.9. And finally, Z68.45 is coded when the BMI is 70 or greater. The adult codes end at Z68.45. Now let us see an example. A 45-year-old male presents with morbid obesity. BMI is 45.2. Here the BMI is 45.2. So that is in the range here 45.0 to 49.0. So the appropriate code is Z68.42. And BMI should be coded only when there is relatable diagnosis such as obesity. Here a 45-year-old male presents with morbid obesity and the BMI is 45.2. In that case, first PDX would be morbid obesity code, that is E66.01, followed by Z68.42 to indicate body mass index in the range 45.0 to 49.9. Now, Z68.5 deals with child, body mass index of child, and it is governed by percentile for age. If you can see here, Z68.51 indicates body mass index pediatric, less than 5 percentile for age. The next is Z68.52, BMI pediatric 5 percentile to less than 85 percentile of age. The next is Z68.53. It indicates body mass index pediatric 85th percentile to less than 95 percentile for age. And finally, Z68.54 indicates body mass index pediatric greater than or equal to 95th percentile of age. And in the documentation also, the physicians will document on the basis of percentile only when it is pediatric. Now let us see an example. A 5-year-old child presents for well child visit. BMI is 97 percentile of age. 97 percentile of age. Here that is greater than or equal to 95th percentile of age. Here 97 is greater than 95. So the appropriate code is Z66.129 followed by, it is also indicated that the child is obese. The physician documented that the child is obese. It indicates he is suffering from obesity. So first is at 00.129 to indicate well child visit without abnormal finding. Then followed by E66.9 to indicate obesity. Then Z68.54 to indicate body mass index pediatric greater than or equal to 95th percentile of age. The next category is Z78, that is other specified health status. It has three codes in it. Z78.0 indicates asymptomatic menopausal state or menopause state NOS or post-menopausal state NOS. The next is Z78.1, physical restraint status. And finally Z78.9, it indicates other specified health status. Now coming to Z79 category, that is nothing but long-term current drug therapy. There are various codes indicating each type of drug. The first code is Z79.01. It indicates long-term use of anticoagulants. Followed by Z79.02. It indicates long-term use of antithrombolytics or antiplatelets. The next is Z79.1. It indicates long-term use of non-steroidal anti-inflammatories, NSAIDs. The next is Z79.2. It indicates long-term current use of, everywhere current is there. So Z79.2 indicates long-term use of antibiotics. Z79.3 indicates long-term use of hormonal contraceptives or birth control pill or patch. The next is Z79.4. It indicates long-term use of insulin. Next is Z79.51. It indicates long-term use of inhaled steroids. Next is Z79.52. It indicates long-term use of systemic steroids. Now here are the set of new codes that have been added since October 2022. The first code is Z76.60. Long-term use of unspecified immunomodulators and immunosuppressants. The next is Z79.61. Long-term use of immunomodulator, apremilast, immunomodulatory imide drug or lenalidomide or pomalidomide. Whenever the physician documents long-term use of any of the below listed drugs, the code is Z79.61. The next is Z79.620, long-term use of immunosuppressive biologic or long-term use of adalimumab or etanercept or infliximab or monoclonal antibodies. Whenever the physician documents any of this, the code is Z79.620. The next code is Z79.621, long-term use of calcineurin inhibitor or cyclosporin or other drug is tacrolimus. Whenever the physician documents long-term use of cyclosporin or long-term use of tacrolimus, the code is Z79.621. The next is Z79.622, long-term use of Janus kinase inhibitor or long-term use of tofacitinib. The next is Z79.623. It indicates long-term use of mammalian target of ramamycin inhibitor, MTOR inhibitor, or long-term use of sirolimus. Then also you can quote Z79.623. The next is Z79.624, long-term use of inhibitors of nucleotide synthesis. Whenever the physician documents long-term use of azathioprine or omicophenolate or purine synthesis inhibitors, IMDH, the code is Z79.624. The next is Z79.630, long-term use of alkylating agent, or whenever the physician documents long-term use of chlorambucil or cisplatin or cyclophosphamide, any of these drugs, the code is Z79.630. The next is Z79.631, long-term use of anti-metabolite agent. These are all anti-cancer drugs. The long-term use of 5-fluorouracil or 6-mercaptopurine, or long-term use of cytarabine, cytarabine, or long-term use of methotrexate. The code is Z79.631. The next is Z79.632, long-term use of anti-tumor antibiotic. For example, bleomycin, doxorubicin, mitomycin C. Whenever the physician documents long-term current use of any of these drugs, the code is Z79.632. The next code is Z79.633, long-term use of mitotic inhibitor, or the drugs, examples of drugs are paclitaxel, or long-term use of plant alkaloids, for example, vinblastine and vincristine. In all these cases, the code is Z79.633. The next is Z79.634, long-term use of topoisomerase inhibitors. For example, etoposide, irinotecan, and topotecan. The code is Z79.634. The next is Z79.64, long-term current use of myelosuppressive agent, for example, hydroxylurea. The next is Z79.69, long-term use of other immunomodulators and immunosuppressants. These are all new codes. The next code is Z79.810. These are old codes only. It deals with long-term current use of selective estrogen receptor modulators, SCRMs, or long-term use of raloxifene, Evistas, or long-term use of tamoxifen, Nolvadex, or long-term use of torimefene, Ferrestone. These are brand names. The next code is Z79.811. It deals with long-term use of aromatase inhibitors. The next is long-term use of anastrozole, or whenever the physician documents long-term use of aromatase inhibitors or anastrozole or letrozole or exemestane. In all these cases, you need to code Z79.811. And finally, Z79.818. It deals with long-term use of other agents affecting estrogen receptors and estrogen levels. For example, estrogen receptor downregulators, fulvestrant, or gonadotrophin releasing hormone agonist, or gosirelin acetate, or luprolide acetate, or magastrol acetate. In all these cases, the code is Z79.818. The next code is Z79.82, that is long-term use of aspirin. The next is Z79.83, long-term current use of bisphosphonates. The next is Z79.84, long-term current use of oral hypoglycemic drugs or oral anti-diabetic drugs. The next is Z79.85. This is also a new code, long-term current use of injectable non-insulin anti-diabetic drug. The next is Z79.890. It deals with hormone replacement therapy. Next is Z79.891. It deals with long-term use of opiate analgesic or methadone for pain management. The next is Z79.899. Other long-term drug therapy. Now let us see an example. Patient with IDDM, that is insulin dependent diabetes mellitus. It is nothing but a synonym for type 2 diabetes mellitus. Patient with IDDM on Ozempic, Lantus and metformin. Here metformin is an oral anti-diabetic drug, whereas Lantus is insulin and Ozempic is injectable non-insulin anti-diabetic drug. So here first the PDX would be E11.9, that is type 2 diabetes mellitus, followed by Z79.4 long-term use of insulin, long-term current use of insulin, then Z79.84 long-term current use of oral anti-diabetic drugs, and finally Z79.85, which is nothing but long-term use of injectable non-insulin anti-diabetic drug. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.